Hemoncus. Before we talk in detail about how to treat for fluke, I just want to touch upon the control of another important parasite in sheep, and that's Hemoncus. Sometimes known as the barber's pole worm, this parasite lives in a sheep's stomach and sucks blood. A significant quantity of blood, in fact. A light parasite load of around 1,000 worms can be responsible for a sheep losing 50 millilitres of blood a day. Your young lambs are most likely to be affected, and that can represent a lot of blood for these animals. So anemia is common, and there may even be sudden deaths within the flock. Bottle jaw is also sometimes present. The worms also damage the lining of the abomasum, making it harder for the sheep to digest their food. This can reduce growth rates by up to 30%. Hemoncus worms can lay up to 10,000 eggs a day, and those contaminate the pasture, providing a source of infection for other animals. In warm, moist conditions, the eggs hatch out into larvae that infect the sheep, so illness due to Hemoncus is most often seen in summer and autumn. Thankfully, Closentel, which is used to treat fluke, is also effective against Hemoncus, providing up to 6 weeks invaluable protection during this at-risk period. As we'll explain later, there are also benefits to treating for fluke at this time of year too. So if you can get the timing right, your flock will receive a dual benefit from treatment. It's always going to be important to be strategic about treating for Hemoncus, as the signs are seen only after the damage has been done, and we really want to target treatment at the right time in the right way to reduce pasture contamination and help prevent economic losses or loss of stock. Closentel. Flukiver and superworm contain Closentel, a type of flukicide that kills adult and immature fluke. Closentel does some interesting things to fluke. For starters, it kills 97 to 100% of adult fluke. It also kills over 90% of fluke in the 5 to 8 week old age bracket. But it doesn't stop there, because Closentel can also stunt the younger, immature fluke, meaning that their growth is slowed and they develop abnormally to such an extent that they're smaller, less fertile and less able to lay eggs. Because Closentel prevents fluke egg laying for 13 weeks, treatment can result in less pasture contamination and fewer viable eggs. This means that there are fewer larvae to develop and cause reinfection in the future. Best of all, though, is that it's a different type of product to triclobendazole, so it's useful to include in a strategic rotation program. Resistance. Closentel also works on triclobendazole-resistant fluke. Now, we've got to be concerned about resistance because there are only a few classes of flukicide, and once resistance develops, it may not revert. You all want the widest choice of treatments available to treat flocks and to keep as many options open as possible. You also don't want to treat only to find months later that the treatment didn't work as well as you expected it to, and to experience losses as a result. Most of you will have heard of rotation by now. The experts say that rotation of treatments between chemical groups may well help reduce the likelihood of resistance developing. But what does that mean? Well, simply this: don't reach for the same flukicide every time. If you just use the same product year in, year out, chances are that in the future you'll run into problems. And once you have resistance to a product, you may never be able to use it again. Strategic programs. We've used the word strategic several times now when we've talked about treatment programs. By strategic, we mean more than 1 or 2 traditional autumn doses. Strategic programs involve looking closely at your individual farm and working out a program that can actually reduce the Fluke challenge. You might want to get your vet or animal health advisor to help you develop a plan that reflects the actual risk in your particular circumstances. Strategic dosing may use one or a combination of treatments spread through the year to achieve longer-term control. The pattern will probably need to be revised year on year to reflect the fact that you're gradually lowering the challenge on the farm. Early spring treatments and summer treatments fit well with strategic dosing programs. Early spring treatments are ideal to kill adults and reduce egg laying so that pasture contamination is kept to a minimum before the snail population starts to increase. Pasture contamination with Metasicaria starts to increase in midsummer. Now you'll remember that those are the infective forms eaten by the sheep. Start to treat midsummer and repeat the treatment every 10 to 12 weeks until the end of the year, possibly more often in heavily infected areas. So why should we do that? Well, by treating early, we're treating small fluke burdens and we're stopping the fluke from maturing and laying eggs that might further contaminate pasture. It's a very economical way of approaching things because frequent dosing in the early years is followed by less frequent dosing in later years. Eventually you get to the stage where reduced frequency dosing still allows sustained control because the threat has been reduced to negligible levels. We have to be careful, of course, to keep rotating the choice of flukicide and to depart from the programme if it's indicated. For example, by treating brought-in animals or increasing the frequency if there are especially high numbers of fluke or late ongoing challenges due to mild winters. Summing up. So let's conclude by thinking about what you can do to control fluke. 1. You can drain wet fields that provide the ideal habitat for mud snails, or keep sheep off boggy, wet land whenever possible. Not always easy, I know. 2. You can treat cattle as well as sheep for fluke. 3. You can try to minimise contact between sheep and any relevant wildlife. Now, some of the farms I visited would find that very difficult, but maybe that's possible on your farm. 4. You can quarantine and treat brought-in animals. 5. You can use planned strategic programs using flukicides like Closentel to reduce the level of the fluke challenge. 6. You can appreciate that resistance is a real threat and rotation of flukicides between different classes of products is in every farmer's best interest long term. Remember, fluke is a serious disease and it's a changing one. You can't rely on old routines and habits to fight the threat of fluke. Good luck with fighting fluke.